Bond exists to support and promote and advocate for the voluntary community and social enterprise sector, and that sector plays a big part in delivering health and wellbeing services to communities across the North East and North Cumbria. We need to make sure that we've got a strong social prescribing system that's going to support the move towards neighbourhood health, and we need support for the social prescribing workforce to make sure they can deliver and are aware and have the skills to do that.
Social prescribing is non-medical support around things that affect health and well-being. We support people who've been through a lot of different things in life. Everybody's journey is a bit different. It's very challenging at times. Sometimes you do meet people when they're at the lowest points in their life, and you can help them make a plan and support them to get to a place where they want to be.
We've got a range of projects ongoing, so we've got International Community of Sunderland, West End Refugee Service, we've got Groundwork North East, Edbert's House in Gateshead, and Men's Pie Club.
I've been a social prescribing link worker for around 5 years now. Today I have brought a patient along to the Men's Pie Club. It's something that we've worked on for a while, building up the patient's confidence to come here today. So just coming along as a friendly face to support the gentleman to this session.
Men's Pie Club is a social enterprise that gets guys together. It helps guys tackle mental health struggles. Guys can come in, have a cuppa, make a pie, have a chat. Local guys making pies.
At first I was in a dark hole, so I was suicidal, but Pie Club made a massive impact. Came back every week, plucked up the courage, and here I am today. Now I'm a volunteer. I love every minute of it.
A social prescriber can sit down with the person and look at what's going on in their lives, and it might be stresses caused by things like poor housing or insecure work or isolation that's causing that person to feel unwell.
One of the biggest problems that we find when people first enter the UK is social isolation and loneliness. Quite often we'll get people that come to us that don't understand about going to the optician or the dentist or whatever that may be, and we signpost people. We also do a weekly welcome. We cook meals together. That's always a really, really nice time to chat. Adult colouring in and stuff, just giving people something to do with their hands so that if they don't want to talk and they just want to be around other people, it's not awkward.
I feel happy to meet new people, learning new things, and also maybe share something that I know.
When you come here, it changes your perspective. Like you meet friends, you meet different people, you create friends, and in my house, I just feel like, I'm just alone and the world is not with me, but like here, I see the world around me in different perspective with different people.
Social prescribing has made a huge difference to the people that come to us. It allows us to really focus our groups, to listen to the refugee community, to really hear them and understand exactly what they need, exactly what barriers they are facing, what mental health problems they've got, but in a safe space.
Often people in marginalised communities find it hard to engage with services and often have the highest levels of health inequalities. So we're trying to address that with these projects.
ICOS has been around since 2009, and we support migrant people in Sunderland and the surrounding area with accessing benefits, accessing healthcare, accessing services, but also helping them to integrate within the wider community and providing activities just to make sure that they are part of Sunderland.
We came across people who actually were scared to try new things, and they finding out that with the small groups, it's much easier.
It's a community where different people come together and get to meet new people, gain new experience, immigrants, people, everyone. And it's a really welcoming place to be.
As immigrants, sometimes it's very difficult to hook up with people. The social life is not that easy like in our countries, and this is a good opportunity for us to go out with people and to socialize and have some fun.
By socializing, you get access to opportunities, you be able to share ideas, rub minds, and you're just I mean, you're just happy.
And most important, of course, I feel safe.
Yeah.
You know, to walk together with a group of people that we know.
Yeah.
Social prescribing helps tackle those root causes. It's part of that left shift that the government wants to see towards prevention, and it can reduce things like GP visits to hospitals, so it can save the NHS money, but it does need investment.
Today we are in Ashington Community Woods and we are with a group of volunteers who are here every Monday, and we're just tidying up some trees down the side of the old railway line that runs down here. It gets you outside, gets you some fresh air, a bit of exercise, and also getting to learn some new skills.
Yeah, it keeps me fit. I like to think of it as a green gym. You know, get a good workout once a week at least, get my heart beating.
Really, it's just to make it a nice place for people to come, to enjoy, to walk the dogs.
I just love it. I just love outdoors and trying to help people, trying to keep things tidy and clean.
Social prescribing is a pathway that's been set up recently for this group, so they can come along and then maybe they might want to give a little bit of their time to the project, and that's the stage that we're at basically, where we're welcoming people, but we need a link worker to sort of hold the hands of people to bring them here, because I think peer support is so important.
Just felt so welcome, and I would really love anybody else to get involved if they would like to give it a try, because you just never know, it might change your life.
We're off to Talking Marrows after this, and it's going to be over at the community centre in Hurst.
Talking Marrows is about being there. So being there for each other, basically. That is all it is. We get together, we meet, we have tea and coffee, we chat. Anybody's got an issue, somebody tries to help them. If we can't, we'll look further afield.
I was at the lowest point in my life and got referred through my doctor, my GP, because of my depression, that, you know, when my bereavement. I regarded them as my second family because they helped us through with a lot of stuff.
Isolation is a huge factor in making people feel stressed and unwell, and these projects can build people's confidence and their resilience and get them more connected into the community, and therefore able to access more support that's going on in their community.
Tea and Toast runs here at Reckitt Family Hub every Friday morning, 9:30 till 11:30. People come along, it's encouraging them to talk and socialise with others from the local community, and it also gives them a chance to ask advice and support. Everyone's just happy to see each other, and it's really nice.
It's helped a lot, yeah. I feel a bit more better where I'm living now, because I've met people near where I live.
You're getting out the house, you're getting ready, you're talking to people, you can talk to people about the problems that you've got. They're talking to you about their problems.
It's helped me with my confidence, my self-esteem, building my relationships up, and obviously my overall well-being, whereas before it was just shot to bits.
We've got community development workers and we have youth workers, and then our other arm is the social prescribing arm. We link the people with community resources.
Emotional well-being is where we provide the most support, and it is where we made the most impact as well. And just making someone feel better, hey, doesn't cost much.
The Hey tool, which is it's got all the items on there, so it's anything from money, housing, friends, family, emotional well-being, physical health and social connections, and employment, education and volunteering. So we cover all of those in our assessments to find out what's most important to that patient.
So we really want something to help our patient to say, hey, this is one thing I want first. I want to deal with this first. And it had to be from them, because we want them to have the ownership of whatever plan we come up with.
It's been a godsend to me. I mean, I would have been just sitting looking at four walls basically on a Thursday.
It was my safe space back in the day. It was the only place I ever went. And obviously through Airbat, I have managed to progress and I am working full-time now.
It's just been absolutely amazing for them coming in. It's been a really positive outcome for the local area.
And the impact of social prescribing is huge for individuals and for the health and care system. So it will deliver improved health and well-being, it will reduce health inequalities, and it will save the system money and resources in the future.